Welcome to USA Global TV and Radio, where our mission is to provide education, entertainment, hope, and inspiration. USA Global TV and Radio connects you with experts and audiences all around the world every single day to help you succeed in business and to live a richer life. Visit us at usaglobaltv.com to learn about career and life-changing training and mentoring programs like the Listening Mentor. Subscribe to our newsletter to stay informed about our special programs and offers. Discover how you can become a guest on one of our shows or a host or producer of a USA Global TV and Radio show of your very own. That's USA Global TV and Radio, where the doctor is always in.
Good morning, good afternoon, good evening, and welcome home to USA Global TV and Radio. I'm Dr. JACALYN KERBECK, and our show today is Hot Topic. We're going to be talking about platelet-rich plasma injections. And in case you haven't met her in one of our other programs, we have a special guest who has come back to see us again. We're very excited to have her. So let's bring out and have you welcome. Big round of applause for Dr. Teresa Cody. Hello.
Hey, how are you, doctor?
Hey, nice to see you again. How have you been in the last, 3 days or so?
Well, I've been really good.
Well, you look like you're glowing, and you look like you're in a different venue than you were last time. Where are you today?
Yeah, this is my wellness office. So I was at home last time. So I have to work today. It's Monday.
Doctor, what does a typical workday look like for you?
Well, I have a nurse on staff, and we see about 5 or 6 patients a day. We do platelet-rich plasma injections for everywhere, actually, and we'll get into more specifics. And we do vitamin infusions, and so it's very fun. You know that I'm a dentist, and really platelet-rich plasma has been in the dental world for over 30 years. We used it in bone grafts because there's really no blood flow in the jaw. So if you didn't use it, you didn't get a good bone graft, then you don't get a good implant. You have to have bone. So we've been using it there for years and years. Orthopedics used to use it in joints. They don't seem to, I think insurance doesn't like to pay for it, so they kind of dictate our medicine. But we use it here at the Wellness Center for everything, for glowing skin. And I think I'm due for another round. But my nurse, we use it for torn rotator cuffs, plantar fasciitis, hips, knees, like I said, shoulders, hair loss. It's phenomenal.
That's really exciting. Thank you for sharing that with us. So you're a dentist, you're also an entrepreneur, and you're someone who helps people feel and look better. I'm wondering if you could break it down for us and tell us what are platelets and what is plasma?
Okay, so what we do is we draw your blood and we put it in a centrifuge. And it spins, and the red blood cells fall to the bottom. They're heavier, and the plasma sits on top. We put an anticoagulant in because platelet-rich plasma, the platelets' first job is to clot. So you have red blood cells, there we go, and then a layer of platelets, and then plasma on top. And so we pipette off the plasma and the platelets, and then we use that to inject into any area that is hurt or that we would like to concentrate the healing. Because in the plasma are at least 15 growth factors. That's what they've found so far. But when I was studying it 5 years ago, probably there were 7 growth factors. It just tells you there's probably many more, but they haven't found them yet. So what I mean by a growth factor, they should have called them healing factors, but they didn't ask my opinion on that one. So in there, they're proteins. So the protein calls and gets stem cells to the area, right? And then there's another growth factor that tells the stem cell what to become. Because as lots and lots of viewers know, stem cells are like the beginning cell. It can become anything that the body needs it to become. So if you had stem cells out on the counter, they stay stem cells until you put plasma. And they need the plasma to dictate what they will become. So we use that knowledge that those are the healing factors. And basically the plasma has all the healing. I call them directors too. They're like directing the show. If you skin your knee, 10 days later you look down and it's all healed up. How did that happen? Well, when you hurt yourself, the plasma comes to the area and starts the healing process. The platelets clot and you form a nice scab, and then the plasma directs forming new skin, and you're going to form new blood vessels and collagen and all the things that go into healing any area. So we use that knowledge to concentrate the healing in your face or in anything that's hurt, especially ligaments and tendons heal up beautifully. Been surprised about how fast nerves have healed up, because I learned they heal 1 millimeter a month. They're very slow. When you put plasma in, you really get fast reactions from nerves. Because I've used it, we've treated a number of Bell's palsy cases. So interesting that could even change at all, in my view. One of them had Bell's palsy. One case, he had it for 27 years. So
incredible. So you're a dentist / doctor. Right.
I'm a doctor of dental surgery.
Yeah. So have you found that the dental industry is moving or has already moved in this direction to offer these types of services?
Not outside of the bone grafting. I also have a medical director, so that my nurse can practice outside of my license, because I really can do head and neck. But yeah, so I have not seen that dentists are using it for like the vampire facial, which is what Dr. Runnels coined. Only because the vampire is using blood, but it's actually the yellow part of the blood, not the red part.
And Dr. Cody, a question I have for you is, you mentioned about the process to get the blood. Would there ever be a reason why we'd need blood from someone else to do these procedures?
We don't do that. We only use your blood, but it's very common. Let's say you had a head injury in the hospital, you would get, that's why they pay for platelets and plasma, because you would get somebody else's platelets and plasma to stop a brain bleed. So yes, they're used. And when people are really, really sick, they don't have enough plasma. And if you see how fast things heal, without it, you're really not doing well. So they do use other people's plasma.
Thank you. Thanks for explaining that. We were talking a little bit backstage about an event that you just attended, and I'd love to hear more about that because I really feel like it falls in line with how we see ourselves, how we feel about ourselves. What can you share on this topic?
Well, I just took a 3-day mindset workshop with a woman. Her name is Bellany Anosh. I might not be saying that correctly. And she is Live at Choice, just in case you want to look her up. And it was very, very enlightening. And yeah, our mindset, no matter what we think, we're right. And it was all about the subconscious doesn't know what's real and what's not real. So whatever we imagine is correct. And she didn't bring this story up, but I remember reading a story about a prisoner of war, and he played golf in his mind every single day that he was in prison. And when he got out, he was a scratch golfer because the brain didn't know he wasn't really practicing. So what we think really makes a difference in everything. So I just found it fascinating, and it's just always a work in progress. But it is important to how you look, because how you feel about yourself. You know how we're so judgmental about ourselves, and we probably just need to give ourselves a little break.
I know what you're talking about. I'm very hard on myself. Something when it comes to perspective, and I always felt that this is a challenge, is something that I work on a regular basis. We can work on ourselves over and over for years, and we do the deep work, and we're ahead of where we were. Yet we're in an environment with people who are way far somewhere else. And so that world, that reality is always tugging at our reality. What are some things that you can recommend or that you've done or people shared with you about how we can stay fully present and engaged with ourselves in our own mind, as opposed to the distractions of people, maybe even our own home or people who are in our office?
Oh, yeah, that's the tough part. Really, really important to find like-minded people. Because those low frequency, fear-based people, they'll bring you right down. It is amazing how fast. I think it's very easy for the human being to go negative. I think that doesn't take any energy at all. And I think it takes energy to be positive. And we all have subconscious stories running in our heads. And did you know the subconscious, before you think you're making a choice in your conscious mind, but your subconscious runs about 10 seconds ahead. So that story that you made up when you were 5, that, you didn't get invited to the birthday party and you thought it was because you weren't worth it. And it turns out, really, if you knew the backstory, the mother had anxiety, couldn't handle more than 2 children in her house, and it had nothing to do with you. And then we spend the rest of our lives, hurt by not being invited to the birthday party when we got it wrong anyway. So I think it's really important to find those stories and kind of discard them. Rewrite the story, because it probably was the mother and not you. Most people are thinking about themselves. They're not thinking about you. What do I think of Teresa Cody? I don't think of Teresa Cody.
I love this. And I love the examples that you gave today also. And you and I talked about this, I believe, on Women in Business, and I just talked to a friend this morning about this. There's masculine and feminine energies, and as an entrepreneur, as a business owner, maybe even as a dentist, there's a time when your masculine energy is going to kick in and go into overboard. But what I found for me is I'm very safe here in my masculine energy. When I'm in my feminine energy, I'm very vulnerable and susceptible to being hurt or disappointed. So I'm pretty much in my masculine energy 24/7, I realize. What do you feel about that in terms of perspective, masculine and feminine energies?
I think that you're not giving yourself enough credit, as I think that the female energy is very, very powerful. We bring souls to this world. That's a very powerful position to be in. We also are the nurturers for the relationship, but I think the feminine role is very powerful. I think the masculine role is very, very important. And yeah, we have all sides, but I do think that we've underestimated the power of women.
Now, I agree with you. And I think also we're always negotiating in life. It might not be a formal negotiation, but there are times when we are negotiating, even in relationships, personal relationships, and that feminine energy plays a big role. Because if you are kind and sweet and nice, not saying in masculine you're not, but there's a certain way of handling things that you can make people feel like they're the only person in the world.
Well, yes, and if everything is a negotiation. Did you have children?
No, no children.
Okay, all you do all day long is negotiate with them. So the smart thing to do is pick two things that you don't care which one they pick. You give them two choices, they feel empowered, and you win either way.
How many children do you have?
I have two.
Okay.
But they're adults now.
So, what would you say that you learned as a mother that's helped you as an entrepreneur?
That what people want is they want to feel empowered, and children want to feel empowered. And it's hard when they're children because they don't have a lot of power in their lives, right? So that technique of offering two things gives them the power to choose. And it works the same with adults. As an entrepreneur, as for my employees or for the patient, we have a philosophy in the dental office. We're going to tell you what you need, but you need to tell us what you want, because I don't know what you want, and I'm not assuming, but I'm going to tell you what you need. I don't want you come in and then 6 months later, well, you didn't tell me. Well, sometimes it's hard because they need a lot of things and it's hard to tell them, but I want them to know so they can make a choice.
And maybe they can actually start putting a priority list together. So I know, and I shared this before with you, that I've gone into my dermatologist and said, I've got X number of dollars. What can you do for me today? And so, he would say, well, what is it you're focused on? What is it? No, what do you think, doctor? What do you think I should be? No, what do you think? So I do think that it is also an ongoing plan. And that has to do with your perspective. How important are your looks to you? How does that make you feel when you, for example, I love going to the dentist, and I'm actually thinking of getting another cleaning. I just got one a couple weeks ago, but that makes me feel good knowing that my mouth is clean. And so I really honor what it is that you do, because I'm not sure if everyone takes such good care of their teeth.
No, but it's better. It's better, I think, than it ever has been. More people know that they should go to the dentist and get their teeth cleaned, try to keep up with the prevention, prevent having a lot of work done. But, I look at at, let's take beauty type procedures. I look at them as maintenance. I take care of my truck, and I don't really even care about my truck all that much. But I have the oil change. I do what, needs to be done so it will run, right? And I think that if women would look at it as more as maintenance, they would honor themselves and give themselves the benefit of some, not to look younger. I never want to sell that. What I like to do is so you look refreshed and not tired. A lot of women come to me and they said, I look tired and I'm not even tired. And yes, I know. And we start to look sallow. The skin color doesn't look as good. And so that's how I look at, it's not vanity, it's maintenance. And everything takes maintenance.
That's for sure. We'd take care of our homes. And so just put it into the budget. And I'm wondering, when you talk about platelet-rich plasma injections, is this something we can use for our gums as we get older and the gums start to recede?
You know what? I have really started to look into that, and I'm working. We have, my husband is a dentist as well, and we have 3 associates, young doctors, and we've been talking about using it more and more. I have a surgeon come in, and all he does is take out third molars. And so we've used it for bone grafting, but I said, I want you to use it in the socket as a Band-Aid for every third molar. I took him to lunch. I explained everything it did, because it's known but not used. So he started using it, especially in the lower, those lower third molars. That's where you're going to get a dry socket. The uppers, not so much. And he started using it, and literally there's no pain afterwards. Now, I'm not supposed to claim that because you're always going to have one that, I don't know. But literally, like my nephew, he said he had never experienced anything so easy. And I don't know if you had your third molars out, but that was not a great recovery. And the older you get, the harder it gets too. So we've been using it there. So that's a terrific natural Band-Aid. And it reduces pain. But we've been talking about using it in gum recession and in gum disease, because it's antimicrobial, it's antiviral. Of course it is. It has to be. Like when you're a kid, you skinned your knee, you didn't run home. Your mom didn't even, I don't know, there wasn't antibiotic cream at that time. And it didn't get infected. You just rub some dirt in it, you're fine. Well, God put all the antimicrobials in the plasma so you don't get infection most of the time, right? And they did a study. This is very interesting. Do you know what MRSA is?
Yes.
It's that horrible resistant staphylococcus, and it's resistant to all antibiotics. You really get it in hospitals because they do so much sterilization. They killed everything else off, and that's the only thing that's left. They did a study with dogs. This might upset some people, but and they did. They made a wound, and then about a week after, they put MRSA into the wound. And in one set of animals, they gave them all the antibiotics and that we give, like vancomycin and very strong antibiotics. And then in the other set of dogs, they used plasma. And it killed the MRSA, and they recovered much better than the other group with all the antibiotics.
That's
so
amazing.
I have been looking at it for gum disease. How could we use it?
Thank you, doctor. Before someone comes in to have this platelet-rich plasma injection, do they need to go and get a blood test and find out what their numbers are?
No.
No.
Mm-mm. I mean, if you're that sick, you have cancer or you're on chemo, and then you probably will not get a good result, but you're not coming in for, you're too sick. If you're very sick, but the rest of it, sometimes we see actually that they are fighting something. You can see the white blood cells in the plasma, and I'll say, you are fighting something. It's not a bad thing. The body's fantastic. Makes all kinds of great stuff to keep us healthy.
It is. It's a miracle. It's amazing. And we see behind you, there's a number of products. Can you tell us about them?
Yes, they are Osmosis Beauty products, and developed by Dr. Ben Johnson, and they are fantastic. I'm not a big products person per se, but his products are very, very smart. Like, he worries about the delivery system, because putting something topical, how are you getting it in? He worries about, there's no long chemicals you can't pronounce in it. They're tinctures and fruits and all kinds of natural products. And I just adore them. And they are just fantastic. He has done a fantastic job of developing and really thinking about, because the skin is very smart. So, like, he has a product that, instead of Retin-A, I know you've heard of Retin-A, which peels the skin and it's trying to make new skin, but he supports the process because it's a very tightly monitored retinol to its, like, it's, the biochemistry is very regulated. So he supports that, and the skin does it in its own time and in a smart way. Stuff like that. He's really thought about. Like, he doesn't really like dermabrasion and the facial aesthetics don't like him to say this, but you have a certain amount of epidermis, and as we age, really, we don't want to thin it, right? For a very short-term gain of the skin looks better, but you're getting rid of the epidermis. We actually want to thicken it, not thin it. So, and that's what we're using the plasma for, the platelet-rich plasma in the face, is to make collagen, to make more collagen, because we're starting to not make enough. So his products support everything we're doing.
That's exciting. It's nice to have a partnership with someone and bring other aspects to the business. Can you share with us what, if any, role there is for lasers in dentistry as well as cosmetic?
Yeah, lasers. I have a laser in the dental office. It's actually being fixed tomorrow. Once I realized that, everything is going to break all the time, I got calm about it. But they'll fix it. It's okay. What's interesting about light energy is that it heals as it cuts. Isn't that crazy? It literally heals as it cuts, because light activates vibration in molecules. So it stimulates the body to heal as we do surgery with it in the dental office, which is crazy. It's so great. We don't use lasers in the wellness only because the price of them is astronomical. But they do a great job of getting rid of like broken capillaries and stuff like that. Although the platelet-rich plasma does too, slowly over time, because really those capillaries have come to the surface because your skin needs the blood flow. Same with, you know what melasma is? Melasma is a darkening of the skin. And really what Dr. Johnson has said, which I think makes the most sense, because the body's so smart, is that there's a wound underneath that dark spot. The body has brought the melanin to the surface to protect the wound so the sun won't do more damage. And we've gotten great results with platelet-rich plasma and melasma, because what we're doing is healing up the wound underneath. And then the body says, oh, it's all gone. I can take that melanin away. And there you go. It's trying, really, we try to use, the body's so smart. We're not as smart. So we try to use what the body does naturally to enhance, not to take over. Man usually does it in the wrong direction. We're just like they have bleaching products for that melasma, which is, if there's really a wound under there, that's the wrong way to go, isn't it? It would be better to heal the wound so the body can heal itself.
So are you speaking in reference to age spots that people get?
Not so much. Melasma is not age spots. Okay. It'll happen at any age. It happens with specific skin, usually type 3 and 4 skin, which is darker skin. But it can happen with lighter skin too. Yeah. They're big, like they'll be this big. And not easy to cover with makeup. So people hate them, which I understand. I mean, but.
Yeah, thank you. Thanks for clarifying that as well. So as we're coming towards the end of the program, I'd love for us to be able to tie all of this together when you think about the dental work that you offer, as well as these platelet-rich plasma injections, and then perspective. How could we tie all those things together?
She's cruel today.
It's a Monday.
Well, I think, probably the number one is your mindset, right? We sabotage ourselves over and over. And you know, one of the things, being a dentist, you find out that dentistry crosses a line, not for you, but for a lot of people. It really crosses, it's, to be in the mouth is very intimate. And you realize that this is a really hard thing for a lot of people. And I have to tell the staff, especially the dental assistants, that their scrubs are their armor. Because people, when they have fear, they get mean. And that's just a perspective. And then you realize they're nice people. They just were taken over by fear. So the mindset is so important for the person who's the provider of a service, as well as the patient. And, you know, that once you realize that, you realize, oh, they're not mean. They're just scared. And it does weird things to people. I can tell you that. Now, the beauty world, it's a little easier. People want it. They'll tolerate a lot more. So that it's been a little more fun over here.
Well, Doctor, a final question I have for you before you give your contact information is, we see on mainstream television, there are a number of shows about people getting work done and more work done and more work done, then they want to undo the work that they got done. When we think about maintenance, where's that line between maintenance and we've gone too far?
Yeah, no, very, very, very important. And I think that we see Hollywood stars really take it too far. And a lot of women, their husbands don't want them to do anything because they're afraid they're going to end up looking like that. And, you know, my advice is you've got to have an honest and good provider who will tell you the truth. Like, you do not need to do that. This is not going to enhance your looks. You know, you cannot be 22 when you're 62. That's just, that looks ridiculous. It doesn't even look good. So there's a line there. And, you know, it's true. People get body dysmorphia and they have unrealistic expectations about what can and cannot be done. And you really got to go to an honest provider who'll say, no, that's not going to enhance your looks.
I love this point because there are people who will be honest and there are people who just want to take the money, and then the client walks away not really looking very natural. I mean, you've seen like where people, their entire face is pulled back and it's just not, it doesn't look natural. Let's put it that way.
It doesn't look natural, and it distorts the mouth. If you keep pulling, you get all, and of course, as a dentist, that really bothers me. I know, you know, at a certain point, you need some wrinkles. It looks odd if you don't have any. And yeah, it's a matter of finding one who's honest, because they have to be blunt. You have to be blunt with some people, you know. No. And I don't want them walking out of my place and looking odd. You know, don't tell anybody I did that.
Right, because they're a brand ambassador for you.
Right.
Yeah, really
I know.
important.
I had one woman walk in and she wanted filler, and I'm like, where? You're so full, I have nowhere to put it. And you know, no, you can't have any more.
How did she react?
Not good. She hasn't been back. But I also don't tell people I did that, because I didn't do that.
Right. Yeah.
So yeah, no, that's an important question. I wish the people would do a little more maintenance. And when you come in really not having done any, and then, you know, it's only so much we can do.
And you know what I love that you shared on the other program, which is sometimes we delude ourselves thinking that we don't need to get any more maintenance. Oh, I just got this done 6 months ago. Yeah, I can tell you it's been 6 months, because there is only a certain shelf life of these fillers and whatnot that we put into our faces and necks and hand, wherever.
Do you know what I just read, which terrifies me a little bit? There's a delayed inflammatory reaction from people with COVID vaccination and hyaluronic acid, which is dermal filler.
Wow, that's scary.
Yes. And delayed inflammatory reaction means it didn't really happen when they injected. It happens like 2 days later. And
what is it that happened? Do you know?
They don't know. They don't know what the heck. I mean, hyaluronic acid is what most dermal filler is made out of, and that your body makes. So it's a natural product, really. And And they don't know. They think the T cells are overly sensitized. And I saw one study, and I went to PubMed, and then I'm finding study after case study after case study and I'm like, oh, this is not good. Now, it was self-limiting on most except one girl. So self-limiting means after a while it resolved itself. But that is particularly unnerving, that the body would react to something that I've been using it for 20 years. I've never seen that kind of reaction.
So in your practice, you haven't observed this. It was just something that you read.
I read it and I was like, oh, what is this? And then I saw one case study. I thought, okay, one case study. And then I went and looked, and no, there were a number of case studies. There's a because it's worldwide. You're going to have, there's a lot of South America. They do a lot of beauty type procedures. And so it was probably about 4%.
Interesting. It's always good to do research so that you can be informed and share with your clients what's going on too. So thanks for sharing that with our audience today.
Yeah, just be ready. I was like, oh, yeah. So the immune system might be overly sensitized. That was the hypothesis. I don't know. We don't know yet.
Fingers crossed. Dr. Cody, thank you so much for being here today. We have to wrap up as we have another show. We have your information on the screen. How would you like people to contact you, and who would you like to contact you?
That is the dental number. So call the dental office, make an appointment. You can see me either there. I do. My wellness is right next door. It's my own building. Go call us or email us, and we'd love to see you.
And doctor, can you tell us where you're located?
Yeah, we're in Sugar Land, Texas, which is right outside of Houston. We're Houston, Texas, basically.
Okay, fantastic. As I mentioned before, we love our friends in Texas. So we're glad that you're here today. We hope you come back and see us again.
All right. Thank you so much. I really appreciate it.
Thanks. Enjoy the rest of your day.
Thank you.
Bye for now.
Bye.
And thank you to each and every one of you, whether you're watching on the live or the replay. We really do appreciate you. If you're interested in being a guest on any of our shows, please go to our website, which is usaglobaltv.com. Go to book your session, scroll down, and find a show that resonates with you and book in. All right, we'll be right back with our next show. Thank you so much to each and every one of you. Bye.